My name is Dr. Patrick Lappert. I'm a plastic and reconstructive surgeon. I've got over 35 years in the medical field now, and I've never been to a lecture or read a textbook or read a scientific paper that presented the human person as a spirit being that may or may not be occupying the right body. That's superstitious thinking. That's magical thinking that's just generally frowned upon in the medical community. And yet, we now have professionals in my specialty who speak this way. It's a rehearsed kind of language to justify something that is essentially unjustifiable. So what we're seeing here is a medical condition where a child, a pre-adolescent child, is making the diagnosis, and there's nothing that I can do to prove or disprove it, which is remarkable, because there's no other medical condition that leads to a massive surgery and medical intervention where the diagnostician is a pre-adolescent child. I think it's important to hear what a plastic surgeon says on the subject, because when I was in training, we were taught that there's a subcategory of plastic surgery patients who will come to you seeking a modification of their face, for example, and it seems like an ordinary request, like, could you make my nose a little smaller? And you start to examine them, and what you come to find out in interviewing them is that they're very sad people. And they have very high expectations of what surgery is going to do for their lives. They think, well, if I just change the appearance of my nose, I will be successful, I will have a wife, people will like me. And if you detect that kind of motivation for cosmetic surgery, we're trained to take a time out. This person needs a psychiatric evaluation because that's called body dysmorphic disorder. And it is malpractice for a plastic surgeon to offer surgery to somebody he knows has body dysmorphic disorder. It's malpractice. But we're making an exception in the case of a child who thinks that their genitals are not right, and if you would just change them, they would feel right, that they would feel that they're in the right body. We're trying to heal a wounded child by changing the appearance of their body, and that is malpractice. Puberty blockade in a gender-confused child is an attempt to completely shut off their gonad. And no one has ever proven that's reversible. It's off-label use of the drug. It's not even accepted by the FDA, and no one has done a clinical trial, not one clinical trial, to even demonstrate the safety of doing that to a child. So what we're witnessing in the public arena now is medical experimentation on the most vulnerable members of our society. Consenting to medical and surgical therapy is one of the bulwarks of medical practice. Whenever you're in the practice that cares for children, you have to tread very carefully and very lightly in terms of the parent's right to fully understand what you're proposing for their child, because clearly the child is not going to be able to give consent. That's all changed now because of a very powerful political force at work in the world of medicine on this issue of transgender medicine. Here you have a child that's fully normally functioning, healthy, has an interior anxiety that they express as a belief about their gendered self, but it's an interior wound. They're otherwise physically healthy, and yet you're proposing radically altering their bodies. How does the doctor write a consent form that says this is what the risk is? When we talk about stopping clinics from giving puberty blockade, is because in giving the puberty blockade, what you're doing is you're consigning them to a life of being different. They come in thinking that they're different, but they're not physically different. You start giving them the puberty blockade, and within a year or so, they're falling behind their peers. They're not growing skeletally. They're not maturing intellectually. And now they can look at themselves and go, wow, I really don't look like everybody else. There is something wrong with my body. Puberty blockade and cross-sex hormones are sort of temporizing band-aids, right? Because they're making the child feel better. But the wound that causes this desire to self-harm is still there, lurking in the background. And when you run out of things to offer them in the transgender world, the suicidality is higher than if you hadn't done anything to them at all. Historically, the way we manage gender anxiety in children is what's called watchful waiting. What you find is that somewhere near 90% of those children will desist in that idea. That is to say, they will abandon this cross-sex idea of themselves. If you take those same children to a gender clinic and you start enforcing this idea with what's called affirmation therapy, where you encourage them to believe that they are in fact the other sex, when you offer them puberty blocking, when you offer them cross-sex hormones, when you encourage them with how to cross-dress, change their name, change their hair, their presentation, 100% of them will persist. What does that tell us? On the face of it, it tells us that gender clinics are mistreating 90% of their children. There's no area in medicine where that would be considered acceptable. Absolutely none. With absolute clarity, I will call that child abuse.